There is a health and human rights crisis in South Los Angeles. The 1.5 million people who call South LA home face severe inequities, extreme poverty and homelessness, joblessness, lack of access to healthy foods, unsafe housing, and inadequate schools. These conditions are comparable to those in many developing countries. The poverty rate in South Los Angeles is 28%. The poverty rate is 19% in Yemen. Life expectancy for adult males in South Los Angeles is 68 years old, the same as adult males in North Korea, and nearly 10 years below the U.S. national average. 31.7% of adults in South Los Angeles are uninsured. 17% of adults are uninsured in Hungary. 29% of adults in South Los Angeles are diagnosed with hypertension. 18% of adults are diagnosed with hypertension in China. 11.7% of adults in South Los Angeles suffer from diabetes. 10.6% of adults are diagnosed with diabetes in South Africa. The immunization rate in South Los Angeles is under 75%. The immunization rate is 90.2% in Brazil. Over 10% of children in South Los Angeles suffer from asthma. 5% of children suffer from asthma in Zimbabwe. The infant mortality rate in South Los Angeles is nearly double that of Cuba. These conditions are more than disparities. They are human rights violations. In the 1940s and 50s, LA's Central Avenue business district thrived, and black families moved to middle-class neighborhoods. In subsequent years, as was the trend with black communities across the country, South Los Angeles was largely excluded from social and economic development by the civic power structure. Those that remained in South Los Angeles were shut out from public funding, discriminated against by banks and other financial institutions, ignored by those elected to represent their interests, and subject to oppressive and unfair treatment by law enforcement. Hard-working families witnessed the disintegration of community resources and a sharp decline in overall quality of life. On August 11, 1965, South Los Angeles reached its boiling point. Tensions from years of discrimination finally erupted into 6 days of unrest. Hundreds of buildings would burn, 4,000 people would be arrested, over 1,000 injured, and 34 people left dead, most at the hands of local law enforcement. The once prosperous middle-class community had been overwhelmed by isolation, lack of services, police brutality, neglect, and decades of broken promises. But in the wake of this bleak moment, the people of South Los Angeles united. Faced with the destruction of their communities, leaders emerged from housing projects, schools, churches, labor unions, and community clinics to organize residents, shine a light on social injustice, and give voice to the demand for fundamental human rights. Beginning in the wake of the Watts Revolt, in the days following the 1992 civil unrest, and over the course of South Los Angeles's history, a grassroots movement has developed, giving birth to a myriad of community organizations. Their mission: confront the various health and socio-economic hardships facing residents of this ever-evolving community. Today, we take the lesson of strength through unity to a global level. We acknowledge that human rights are universal, inalienable, and interdependent. Our goal: to illuminate and connect our efforts through the lens of health and human rights. Human rights is a common language that gives us common purpose, in improving the overall health of our communities. We have the right to access the highest quality physical and mental health care. The right to equal access to safe and healthy food and drinking water. The right to a safe school and workplace. The right to affordable and habitable housing. The right to social and economic equality. By declaring and demanding our universal right to health, we will form partnerships not only to improve South Los Angeles, but to create a model that can be implemented around the globe. Support our right to health. Join the South Los Angeles Health and Human Rights Movement.